Hi, this is Andrew Wolf. In this video, I'm going to be talking about oncologic emergencies, in particular, tumor lysis syndrome. Now, tumor lysis syndrome is a sort of interaction between the cancer and the treatment. So now imagine if there are a large number of tumor cells in the body, and inside the tumor cells, we've got, just like any other cells, we've got lots and lots of DNA. And we have high concentrations of certain intracellular electrolytes, in particular potassium. So we have potassium concentrations of about 140 milliequivalents, right? Inside these cells, whereas outside the cell, the potassium concentration is 3.5 to 5 milliequivalents, much lower. So inside the cell, very, very high concentrations of potassium. All right, so we've got, in cases of tumor lysis syndrome, we have very, very high tumor burden. And the cancers in which we tend to have tumor lysis syndrome, the most common is AML, and particularly AML with a very, very high blast count. And what a blast is an immature white blood cell that, or actually a cancerous, a leukemic cell that gets pushed out of the bone marrow because the bone marrow is crowded with these leukemic cells, right? So we've got bone marrow that's crowded with leukemic cells, and we've got large numbers of leukemic cells floating around in the bloodstream. And these leukemic cells, again, what do they have inside them? A large amount of DNA inside the nucleus, and just like every other cell in the body, lots and lots, high concentrations of potassium, right? So what happens is we give them chemotherapy, right? So, and what does chemotherapy do? It destroys rapidly dividing cells. So it destroys these cells, destroys cells in the bone marrow, and it destroys the blasts, the circulating blasts as well. So what happens? Well, the DNA, or particles of the DNA, are released into the bloodstream. So we end up with lots of little bits of DNA floating in the bloodstream, and we end up with high concentrations of potassium in the bloodstream as well. So not that big of a deal. The body can actually manage these things quite. How so? Well, of course, down in the kidneys, all these little bits of DNA and potassium make their way to the kidneys, and down here in the kidneys we of course have our nephron, and high concentrations of potassium move across and are secreted through the nephron into the collecting ducts and out through the urine, right? Now, one part that I left out here is these nucleic acids here that came out of the nuclei of all these breaking down leukemic cells actually get catabolized pretty quickly into xanthines and then eventually into uric acid. So along with the high concentrations of potassium, we have high concentrations of uric acid. And the uric acid is also secreted quite effectively through the nephron and into the collecting ducts. But what happens is when we have very, very high concentrations of uric acid that's getting secreted, it starts to precipitate out in this acidic environment, and the precipitates form and start to block the distal convoluted tubules and collecting ducts. And then we start ending up with acute renal failure. Now, when we start to have acute renal failure or acute kidney injury, then the nephrons aren't functioning well, right? And then what happens? Well, then we end up with a situation where we've got these tumor cells that are continuing to break down and lyse because of the chemotherapy and release their high concentrations of potassium and their high concentrations of uric acid, and the system of secreting them is no longer working. So then we end up with an emergency situation where we have potassium levels rising way beyond, in the serum, rising way beyond the normal 3.5 to 5.0 to 7.5 or 8, and then we end up with cardiac arrhythmias and issues like that. So the reason why tumor lysis syndrome can quickly become an emergency is because of the acute kidney injury that can occur because of the levels of uric acid that rise too quickly for the kidney to deal with, and the precipitation of that uric acid that occurs in the collecting ducts and the distal tubules, leading to acute kidney injury. And then the resulting rapid rise of potassium and the hyperkalemia that can quickly lead to sudden cardiac death. So how do we prevent this? Well, we need to understand that when we have patients with acute myeloid leukemia or high-grade lymphomas or very, very bulky solid tumors, we have to anticipate that tumor lysis syndrome is a possibility, and then we send labs on a regular basis and we check uric acid levels, or we can give a medication called allopurinol, which slows down the production of uric acid by decreasing the rate in which we catabolize nucleotides and xanthines into uric acid. So that kind of slows down the process. So this is, so you really need to sort of be preventative and be knowledgeable about the possibility of tumor lysis syndrome. Keep an eye out for it by watching uric acid levels and potassium levels, and give medications if needed. Okay, so that's a very brief introduction. There's a little bit more complexity to the management and treatment of it, but you can read a little bit more about it in the literature, and I will see you in the next video.